Today, we are going to be piggybacking off of what we talked about yesterday, which was my dream patient for a surgical procedure, things that you should do in preparation for a surgery. Today, we're going to be talking about ways not to ruin your results. Hi, I'm Dr. Emily Johnson. I'm a facial plastic surgeon, and let's talk about ways to optimize your healing and not mess up what we worked so hard to get. Number one on my list is always going to be avoiding smoking and secondhand smoke for several weeks before as well as after your procedure. What it does is it constricts your blood vessels and decreases the blood flow and the much needed oxygen and nutrients that are needed to go to the wound bed. So make sure that you're avoiding that at all costs. You also want to avoid drastic changes in your weight right after your procedure. Little changes are okay, a few pounds here or there, that's normal. But we don't want huge weight fluctuations causing more skin laxity or that volumization looking a little too much after your procedure. We want to make sure that when we pull you nice and tight and we put any fat or do any other supplemental procedures, that those results last. The next question, and I get this one all the time, is when can they go back to the gym? It's very important that you don't go back to your gym lifting, straining, heavy lifting, doing inversions, things like downward dog too soon. Things like that will increase your blood pressure, increase your heart rate, and then that in turn will prolong your swelling and may even lead to scarring. And then lastly, please avoid picking at your incision. This can cause irritation, inflammation, which leads to scarring and scabbing, and it can even cause an infection. So we don't want that. And as always, I encourage patients to read through their post-op instructions multiple times before the procedure, as well as have them on hand after the procedure, just for a little refresher.